But we're here to talk about some of the generational differences when it comes to happiness and how people are feeling about their lives. And I'm really interested in this because I have a young daughter and I'm thinking about, what her life is going to be. And Donna, I wanted to start with you about those striking differences in the young and older generations of, what do you think accounts for that? Is it just, with age, we can tolerate things a bit more? We're kind of done with, some of the drama in our lives, hopefully, or is it something else?
It's a great question to start us off, right? So this report is interesting in the way it tries to impact the differences between age effects and generational effects, right? So the way I think about that is me as a person, my average level of happiness will change over the course of my life, depending on my objective experience and subjectively how I think about my life. But there are also sort of cohorts that we can follow over time, right? And we find in general that there's a U-shaped sort of pattern for happiness, right? You start off really happy, think about your little kid, joyous all day long. And then you slowly but surely make your way down to the nadir. Somewhere around 50 coincides with this midlife crisis. You're looking at your life, all these aspirations you had, did you hit them or not? And then you sort of shift in the way you think about life. And as you age, there is that's where I think the emphasis is on the subjectivity, on you sort of appraising your life and saying, perhaps what matters is interaction. Perhaps it's not that I have a yacht and a jet, it's that I have these interactions. But I also think when we look at cohorts, we can also see specific things in context that explain why, on average, the boomers are a bit happier than younger generations. For example, I grew up in sub-Saharan Africa, and I think about the young person who grew up in the 60s versus one now. So in the 60s, you transitioned, the countries became independent, suddenly you had opportunities, aspirations, the ability to create a better life for yourself. Now, what is the experience of the millennial? We had transitioned from military rule to civilian rule, and we thought, life was inevitably going to get better. And slowly but surely, our leaders disappointed us. And just over the past 5 years, we've had 4 or 5 coups in Africa. What are the opportunities to create a better life for yourself, to make a better income, right? So all of that, the curtailing of your aspirations, right, has sort of informs the way you appraise your life. And so when you think about your future as a young person in sub-Saharan Africa now versus 60 years ago, it's a bit more negative, right? And so I would say it's a combination of the objective and the subjective. And it's a bit of, happiness changing over the course of your life, but the experience of cohorts and, the context and the opportunities available to them that is shaping those differences.
Great. Well, Laura, I wanted to build on that. And, Adana talked about her experience and the experience of young people now in sub-Saharan Africa. And it's sort of obvious when you have government instability, you feel unsafe in your home country. But there was also interesting data about how young people feel in the United States, in Canada, and Australia, and New Zealand, in places where there are at least some economic opportunities. You're hopefully not feeling unsafe in your home, and there's relative stability. What do you think accounts for those results?
Yeah, well, thank you for the question, because I think the striking finding in Canada and the United States in this year's report is a relatively new one, and I think it's quite attention-grabbing. Because if you take a look at Chapter 2 in the report, you can see in most places around the world, in most regions of the world, the youth are reporting higher levels of well-being, and it tends to decline on average across the globe as we age. But North America, with Canada and the United States driving this, seem to be the exception, whereby the youth are reporting significantly lower levels of life satisfaction than the other cohorts. While the report is often designed to look at these big averages and there are many moving pieces, John and Haifeng and some of their colleagues have done some deep dives into the data from Canada and the United States to try to figure out what's going on. And it seems that there are a couple interesting correlates that are observed now with lower levels of life satisfaction that we didn't see in previous years about 15 years ago. Some of that has to do with lower levels of satisfaction regarding one's support from friends and family, and we know that having someone to count on in times of need is one of the top predictors of life satisfaction around the globe, and so feeling unsatisfied with that can be a big predictor big predicament and hurdle for experiencing higher levels of happiness. Younger adults in North America are also reporting lower levels of trust in the government, higher levels of concerns around corruption. They're also reporting more stress and anxiety than they did before, and lower satisfaction with their living circumstances. And so I think there's kind of a cluster of challenges that youth are reporting that are associated with these lower levels of
Do you
well-being.
think that can all be attributed to, especially what young people had to go through during COVID and the isolation from their friends, and it's a time in your life when you're trying to figure out who you are, and part of that is being a part of society in your schools, or is it something deeper? Because it seems like some of the things you talked about go beyond that.
Well, I think it's hard to fully disentangle these effects, in part because the data are relatively new and they do coincide with COVID, and perhaps the next few years will help us sort that out. But it is noteworthy that in many places around the world through COVID, young individuals and females in particular reported some of the lowest levels of well-being and significant drops in well-being, which does coincide with some of the data we see in the Gallup report and in Chapter 3 doing the deep dive on youth well-being as well.
Got it. And Jessica, I wanted to turn to you, especially with the work you've done in the past related to sort of illness and substance abuse, and how that affects people's sense of happiness. And given, especially in this country, we're seeing an opioid crisis, obviously the demographics with an aging population, dementia and other conditions that were mentioned. How does that sort of affect people's views of their lives, and what does that mean for our healthcare system as a whole?
Yeah, absolutely. I think that's a wonderful question, and I think it's not a simple one to answer. I think that one of the things that we have to think about when we think about quality of life and happiness and overall mental health concerns is that it's not just that those things are caused by things like substance use, but they also result in higher things like substance use, right? And one of the biggest concerns when we think about issues like quality of life or happiness from a public health perspective comes down to this idea of deaths of despair, right? Seeing rising rates of, accidental overdoses, suicides, those sorts of things, when people really feel like there's not an opportunity for them to have the quality of life that they're looking for. So I think that that is a very real risk when we don't address this kind of concern, when we don't think about how people are experiencing their life. From a healthcare perspective, I think we need to note, we haven't fully recovered from the impact of COVID in our healthcare systems, right? There are a lot of providers who have left those systems related to their own burnout, their own trauma, their own mental health concerns. And so those healthcare systems are incredibly taxed. And when we're not thinking about how we're going to be proactive about how people can take care of themselves, how they can address some of these concerns, we are potentially setting up, even a more long-term concern around those issues. I think about loneliness is a really good example, right? We're talking a lot about social connection. That social connection is experienced not only in kind of our own subjective, satisfaction of that, it's a risk for depression, for anxiety, but also cardiometabolic concerns and cognitive decline in older adults. And so, we're setting up a system where the problem is not necessarily a health-centric problem, but the long-term adverse effects are going to be experienced in healthcare systems, definitely.
So what does that mean for what can be done now? Because you're talking about, even the people who are supposed to help us in these ways, who have left the healthcare system because of the strains on themselves, and we've seen worker shortages across the board in a lot of these areas. Are there things that the government can do, the private sector, to address these issues?
Yeah, I think one of the things that really strikes me about the happiness report is we're talking about this metric of kind of individual happiness, but really when you look at the variables that are predicting that, or predicting the variation in happiness, we're talking about a lot of systemic things, right? We're talking about, income potential and access to housing and things that really are happening at a system level that we are going to have to rely on large system changes to impact, whether that be through government or not. And so ultimately, I think we need to take kind of a multi-pronged approach, right? We need to be thinking about how do we improve those variables that are underlying because ultimately I think we can't expect happiness to rely solely on an individual to change.
Right.
The other side of that is going to come into play of, how are we really, for lack of any better way of saying this, putting our money where our mouth is, right? If we're seeing that our populations are struggling, how are we investing in the things that are going to help them be able to take care of themselves? And we're going to have to think differently as well. I think we can't talk about these trends in happiness without also talking about, ongoing kind of mental health crisis and, lack of access. And so it's going to require us to think differently about what care looks like, who provides care, how we kind of start to build this into people's daily lives. And that's not just for mental health, but also for just our overall well-being and health, right? How are we making sure that people have the opportunity to build those sorts of things into their lives? But again, I think it really does start at a system level so that we can actually empower people to be able to use these things on an individual level.
So, Adana, I wanted to turn to you especially because you have a global perspective on these issues through your work. What can governments do when they're, don't have as many resources, if the governments themselves are unstable? What does that mean then for the people in terms of their own coping mechanisms and how they can sort of move up in the happiness index?
That's a great question. I think one of the things that's striking to me in the report is that for young people, the country with the happiest people is not necessarily the richest country.
Yeah.
I think that speaks to the fact that income matters and growth matters and living in a rich country matters, but it's possible, regardless of the level of your resources, to think about how you can create an environment that allows people to thrive. Right? We look at a country like Rwanda that has the fastest decline in women dying, children dying. That objectively changes the way you think about your life and your possibilities. So the first thing is, let's start from where we are. What does it look like at the level of income that we have in a Rwanda, in a Kenya, in a Nigeria, to think about access to basic education, to think about access to healthcare, to think about opportunities to grow a business, things like that. Right? And then there is also, yes, we have to grow, right? Yes, people have expectations of their government. And I think if you're living in a country that over 20 years does not have increases in income, then you're unlikely to be someone who thinks that your life is happy. But I don't think the entire responsibility for objectively improving people's lives lies with governments. There are things we can do in community, right? We see in the report, across the report, evidence about the importance of creating, healthy social interactions. And it's interesting that quality matters over quantity. For example, we see that among older people, there are fewer social interactions, but they say, these interactions are better and we are happier. So what can we do to create within our communities environments that are safe, where people can, come together and interact? I think about COVID and the isolation that single people felt, right? So I think the things that our governments can do right now, regardless of where we are, we need to grow and make sure that people have more possibilities. There are things we can do in community. And then there's one last thing I want to point out. I think it's disheartening that in some of the places that are, perhaps the most desperate, we have the least data on happiness. When the report is out, you can look at, the chapter on youth. And for youth between 10 to 15 in Sub-Saharan Africa, South Asia, we know almost nothing, right, about these groups of people. And I think this is where we all come together as a globe to say we need to understand happiness everywhere, because happiness and what drives happiness in the United States is very different from happiness and what drives happiness in Rwanda. So we cannot directly extrapolate, right? And so this is where I would say the responsibility now goes not just from the government to the multilateral and global space to say, how can we come together to better unpack this idea of you are able to live the kind of life that you want to live, and we are all pitching in to at least understand it and work on it together.
May I jump
Yes.
in on one of Donna's earlier points, which I think is fantastic? And one of the points I wanted to make is that I don't think supporting people's well-being comes at the cost of pursuing and supporting other initiatives. In fact, there's a lot of data which suggests that this is a pretty recursive cycle. So happier people are more likely to experience better health, perform better at work, and show better performance on a number of metrics. And so while I think investing in people's happiness might seem at odds, that it's not a short-term solution, it can have this positive cyclical or upward spiral.
Yeah, well, and I wanted to actually ask you about that in terms of the consequences, especially for some of these generational differences that we saw in the report. For young people, if you're starting off in a place where you're not as happy, what does that mean for the rest of your life and how you view your opportunities, what you have initiative for? Does that basically color everything?
The short answer might be yes, but I think there's a lot of nuance to unpack there. And I don't know how long we have. I think we have a minute and a half. So I'll try to, and I bet Jessica has something to say maybe. But the short answer is that I think, yes, people's current emotional state and their happiness state predicts the relationships that they form, their capacities, their abilities to engage in the world, to be healthy and happy. And so while the positive side of that is that once we invest in happiness and people are thriving, they can thrive in multiple domains, but when people are struggling, that might have trickle effects in other parts of their lives. And so in simple forms like earning potential, and I think you'll hear from Dr. Emily Wilroth in one of the next sections, it also predicts dementia in older years. And so I think there's a lot on the line, and I think there's a lot to be learned still.
So a lot, but you can change things then.
Yes.
If it's
Yeah, I think it's in the individual's hands, but also I think there's structural changes that we can make to support people's
Right.
well-being through community, through work. And I think it matters because we care about the well-being of our friends and family and our neighbors.
And Jessica, in our last few remaining seconds here, wanted you to be able to address that from some of the healthcare issues that we were talking about earlier and just sort of the longer term consequences, like we're seeing this sort of moment in time through this report. What does that mean 10 years from now, 20 years from now?
Yeah, I mean, I think ultimately, this, again, the variables that are underlying this are very similar to what we talk about when we think about social determinants of health, right? Mm-hmm. So again, there is this system level change that we need, right? We need to improve access. We need to make sure that people have the things that they actually need to be able to take care of themselves. But I also think that, we're hearing a lot about community, and I don't think we can understate how critically important it is for us as individuals to invest in our own communities, right? And so for those in a younger generation, I think that does require us to come out of, saying this as an elder millennial, like I got to get off of, socials. I can't just Instagram with my closest friends. I need to go and see them, right? And even if I can't see them as regularly as I would like, that quality of that connection, you can't understate it. Mm-hmm. I think, the other piece of this is, we're talking about the other systems that we're living in, and work is one of those, right? And so employers thinking about, how are we driving connection even in a highly remote environment? All of those pieces become incredibly important. And ultimately, they allow us to take care of our happiness, but that's going hand in hand with all of these other domains of health, our mental health, our risk for things like type 2 diabetes or hypertension. All of those things are really grouping together. And so, again, it is going to be this system level change, but it is also going to require us as individuals to lean into things that take work, right? It's just easier to like a picture on Instagram than it is to actually leave my house after a day of working remotely and go see people.
Take off your pajamas. Yeah.
Exactly.
Yeah. Well, thank you so much to all of you for that insight.
Thank you.